Environmental safety. So environmental health is the part of public health science that examines how the environment impacts human health. It's at the heart of public health in community health nursing. Sometimes we can see the impact of the environment being obvious. Sometimes it could be like the recent, the hurricanes that happen, and then there's contaminated water. Some examples where we look at the environment are restaurant inspections, tanning facilities, pools, wells, septic systems. Then we have exposure, and exposure refers to the contact between people and an environmental contaminant. So things that can harm us or things that can make an existing condition worse. So that could be asbestos, lead, radon, mold, pesticides. So the environment can impact human health either positively or negatively. Most of the time we tend to focus more on the negative impacts in the environment, but there are positive impacts as well. A negative impact could be agricultural settings that are exposing people who live and work in them to more pesticides. A positive impact could be the perception of safety when walking by residents in a community. If the resident feels safe when walking, they may choose to do so over driving. This then leads to an increase in activity levels, which then can help decrease obesity, improve cardiovascular health. Also may result in less pollution from cars, which in turn improves air quality. Other positive influences are green space for gardening, neighborhood grocery stores, Then another consideration is that positive and negative environmental influences on health can be interrelated. So an example of that would be lead exposure in a child from a home in which they live. Homes that have been built before 1978 often have lead-based paint, which when that breaks down creates lead chips and dust, which can be ingested by a child. One thing that has been proven to help offset some of the effects of lead exposure is sufficient iron intake. So if that child's home is located in an area where there are grocery stores with access to fresh meat and vegetables, the iron from that food can potentially help lessen the impact of that lead exposure. So the precautionary principle is the principle of playing it safe. It essentially states that if something has the potential for human harm, then precautionary measures have to be taken. So an example of how this is applied. Think about cell phones and some of the data out there that's been reported. Cell phones may potentially alter brain activity. It's not certain, therefore it's recommended that we take precautions just in case until more definitive evidence becomes available. In this example, nurses can encourage the use of speakerphones or the use of earpieces to decrease that exposure caused by just holding that phone up to the head. Another example is a newly planned plant may contaminate the water supply. So we need an example of that would be holding off on construction until further information or testing can be obtained. So an exposure pathway is a process by which someone is exposed to a contaminant that originates from a specific source. The concept of an exposure pathway is important to understand because if that pathway is not complete, or if we break that chain and it's disrupted, then the contaminant of concern should not affect human health. So there are 5 parts to complete the exposure pathway. The first step is the source. What is the source of contamination? What is it? Where does it come from? Now, in your book, Table 19-1 lists various contaminants, where they are, how they are transmitted, populations of concerns, and impact on health. Environmental media and transport mechanisms. So this is, what is the media that the contaminant is in? Is it in water? Is it in air, soil, animals? So the environmental media include groundwater, surface water, so lakes, ponds, rivers, surface soil, subsurface soil, sediment, plants, animals. So knowing the environmental media that the contaminant is in helps determine who is exposed and how they are exposed. Transport mechanisms describe how the contaminant moves from the source to the point of exposure to people. So point of exposure. This is the point or place where someone comes in contact with the contaminated medium. So the point of exposure can be an actual place, such as a home, a playground, a business, a lake, or it can be more of a point, such as a cloud of diesel fumes or eating a meal that contains contaminated fish. Route of exposure refers to how the contaminant enters the body. Did we eat it? Did we inhale it? Did it get absorbed through the skin? And then receptor population. So these are the people that are likely to be exposed. So in your guided notes, a critical thinking question, why is it important to understand the concept of an exposure pathway? And the answer to that is because if you can somehow disrupt the pathway, then the contaminant of concern should not affect human health. So let's apply this to practice, lead. So we know the source, paint that was before 1978. Homes that are built prior to 1978 often contains this paint. Medium and transport. So as the paint deteriorates, because it gets old, it creates paint flecks and chips and paint dust. And so that can accumulate in the house. And even if it's exterior paint, it can be deposited into the soil. So point of exposure, that can either be inside the house with paint chips or dust, or it can be in the soil outside. Route of exposure. We can have kids that eat the paint chips. We can inhale it. Okay. And then receptor population. So these are the people that live in the home or in the surrounding areas. Now, children are at particular risk of greater exposure because they put their hands in objects in their mouths. They play in the contaminated soil. They also have faster respiratory rates. So their breathing zone is closer to the ground, so that may lead to increased exposure. So the goal of determining the goal of understanding the exposure pathway of a given contaminant is to be able to go in and somehow, somewhere disrupt the pathway in order to reduce the negative effect. If that doesn't happen and the pathway is then complete, then there are some important things that we need to consider. So toxicology. So toxicology means the study of adverse effects of chemical, physical, or biological agents on people, animals, and environment. Exposure estimate determines a person's level of exposure to the contaminant. So factors that are taken into account include how long was that person exposed, how often are they exposed, and what is the bioavailability of the contaminant. Bioavailability. So is the amount that is being absorbed or becomes available, I guess, put it in terms of pharmacology. They may ingest so much, but how much of it is actually going to cause a health effect? Okay, so bioavailability is the amount of a substance that is absorbed or becomes available, and how much of it actually ends up in the body, and is it enough to cause a health effect? Biomonitoring, that involves testing to determine the exposure. So with testing, we can tell if a contaminant is present and how much of it is present. What we can't always do is predict whether the amount of the contaminant present will cause enough of an adverse health impact on a particular individual. And this is simply because our ability to test for various chemicals and contaminants has evolved much more rapidly than our actual understanding of the toxicology behind the exposure. So some examples of biomonitoring are hearing evaluations in individuals that have been exposed to frequent loud noises, such as in a factory, monitoring the exposure to of those that work in radiology, blood testing for lead and mercury. So when we're obtaining information from an individual, we need to get exposure history. Okay, so what elements of an exposure history? What do we need to assess? So we need to ask them what is their present work? What do you do on a daily basis? Where did you used to work? Where do you live? What area do you live in? Those of you who have kids, when you take them to the pediatricians, they always ask, what's your zip code? Okay. Activities and hobbies. You know, certain people are going to be exposed to different things dependent upon their hobbies, like the paints, the soldering, pottery. Okay. And then what are their concerns? So we also need to assess current and past exposures, interventions to help decrease the risk of exposure, try to mitigate or reduce adverse health effects from the exposure, so considering vaccines or other protective measures. So also take a look at the table 19.3 in your book. So what is the nursing's influence in working towards healthy environments? Well, we want healthy communities. So we would give input regarding health considerations and planning and redevelopment. So for example, choosing a new school site that would encourage children to safely walk to school. So that would increase the kids' activity levels, create less vehicular traffic in the community. Healthy homes. So think about not only such things as lead and radon exposure, but also a more holistic approach and consider the overall indoor air quality, mold, mildew mitigation, green building, and green cleaning techniques. Healthy schools. So many of them are in older buildings that are in poor condition, that contain environmental conditions that may inhibit learning or increased risks to the health of the children and the staff. So your awareness as a nurse of programs to help schools create more healthy environments makes you a resource for improvement. Healthy children. So need to consider their vulnerability in terms of environmental exposures. So what are things that make them more vulnerable than adults? One, body systems are still developing. Children eat, drink, breathe more in proportion to their body size than adults do. Their breathing zone is closer to the ground. Bodies may be less able to break down and excrete contaminants. Behaviors expose them to more contaminants. You know, adults hopefully don't generally crawl around on the dirt or place their hands and toys in their mouths. We also need to look at children that have spent time in places outside of their homes where environmental hazards may exist. So daycares, in-home daycares, think about summer camps. So we also need to consider where they are going outside of their home.